All right. So, you know how sometimes you glance at a medical report and you're like, what in the world does this even say? Well, today we're going to be tackling one of those head scratchers, the electrocardiogram,
ECG.
right? The ECG. I know all those squiggles can seem a little intimidating at first, but trust me, once you know what you're looking at,
Yeah.
it's like having the secret window into your heart's health. And get this. Our guide for this deep dive is an actual physiology handout from Dr. Rasha Eldeeb.
It's a great resource. And you'd be surprised how much you can actually glean from it, even without years of medical school under your belt.
So let's start with the big picture.
Yeah.
An ECG is basically a recording of your heart's electrical activity, right?
Yeah.
Kind of like listening to your heart's electric symphony. Only instead of sound waves, we're seeing those electrical impulses that make the heart beat.
Exactly. And just like a musical score. An ECG has different components that tell a story. We have waves, intervals, segments, all revealing how well your heart is conducting electricity.
Okay, I'm intrigued already. So Dr. Eldeeb's handout breaks down a normal ECG tracing into a few key parts. First up, we've got the P wave. What's the deal with that little blip?
The P wave is all about the atria, the heart's upper chambers. It represents the moment they depolarize, which basically means they're getting electrically charged up to contract. Think of it as the conductor raising their baton to cue the orchestra.
Got it. So it's the spark that kicks off the whole heartbeat.
You got it. And speaking of a dramatic entrance, next we have the QRS complex, the most prominent wave on the ECG. This is where the ventricles, the heart's powerful lower chambers, take center stage.
Okay, so if the P wave is the conductor's cue, is the QRS complex like the whole orchestra bursting into a fortissimo?
That's a great analogy. The ventricles are much larger and stronger than the atria, so their electrical signal is way more intense, creating that big spike on the ECG.
Makes sense. And after that big crescendo, we've got the T wave, right? What's happening there?
The T wave is all about ventricular repolarization, which is just a fancy way of saying the ventricles are relaxing after their big performance. It's like the orchestra taking a breath before the next musical phrase.
So it's kind of like the calm after the storm. It's interesting that it's a smaller wave than the QRS complex.
That's because repolarization is a slower, more gradual process than depolarization. It's like the difference between flicking a light switch on and letting it slowly dim down.
Okay, that makes sense. Now, Dr. Eldeeb mentions this mysterious U wave. That sometimes pops up after the T wave. She says its exact cause is still unknown, but it might be linked to the repolarization of smaller structures in the heart.
It's true, the U wave is a bit of an enigma. It's like hearing a faint echo in the concert hall. Not quite sure where it's coming from. But even though we don't fully understand it, its presence or absence can still offer clues about the heart's overall electrical activity.
So we've got these distinct waves, each representing a different stage of the heartbeat. But it's not just about their presence, right? The shape, size, and timing of these waves matter too, don't they?
Even subtle variations can hold valuable information about the heart's rhythm and function. This is where things get really interesting, because it's not just about individual waves, but also about the intervals and segments between them.
Intervals and segments. Okay, you're losing me a bit.
Think of it this way. If those waves are the notes in the heart's symphony, the intervals and segments are the spaces between the notes, the rests that give the music its rhythm and flow.
Oh, I see. So what kind of secrets can these rests reveal about the heart?
Well, let's start with the SK segment, a flat line between the S wave and T wave. It's surprisingly important because it can tell us a lot about blood flow to the heart muscle.
Wait, hold on. A flat line can tell you that. How?
It's all about subtle shifts in the baseline. Any deviation from that flat line, whether it's an elevation or depression, could be a red flag for myocardial ischemia, meaning a part of the heart muscle isn't getting enough blood.
And isn't that incredibly serious? Like a heart attack in progress.
You got it. The ST segment is like a pressure gauge for the heart's fuel supply. If it's off, we know there's a problem that needs immediate attention. And that's just one example of how these seemingly insignificant intervals and segments can reveal crucial information about the heart's health.
Wow, I never realized how much information is packed into those tiny squiggles.
So, besides the ST segment, what other intervals and segments do we need to keep an eye on?
There's the PR interval, which measures the time it takes for the electrical signal to travel from the atria to the ventricles. Imagine it as the time it takes for the conductor's cue to reach every section of the orchestra.
Makes sense. So what happens if that travel time is too long?
It could point to a condition called heart block, where the electrical signals are delayed or blocked, disrupting the smooth flow of the heartbeat.
Okay, I'm starting to see how these seemingly minor details can actually be major clues to what's going on in the heart. What else is there? Well, there's also the QT interval, which represents the total time for ventricular depolarization and repolarization. Basically, the entire duration of the ventricles contracting and relaxing.
So it's like measuring the length of an entire musical phrase.
Exactly. And just like a musical phrase can be too long or too short, changes in the QT interval can signal problems with the heart's rhythm. Dr. Eldeeb mentions that these changes could be a sign of things like electrolyte imbalances or even increased vagal tone, which is the activity of the vagus nerve that helps regulate heart rate.
Okay, I think I'm getting the hang of this. So we've talked about the waves, the intervals, the segments, all the different components of an ECG tracing. But I'm still a little fuzzy on how all this information is actually captured. How do they actually record those electrical signals from the heart?
That's where the magic of electrocardiography comes in. It's a fascinating process, and I'm happy to break it down for you.
Yeah, please do. I'm dying to know how they translate those electrical whispers into something we can actually see and analyze.
Well, it all starts with strategically placed electrodes, like tiny microphones picking up the heart's subtle electrical symphony.
Electrodes. Okay, I'm intrigued. Tell me more. Electrodes like tiny microphones for the heart. That's a pretty cool image. But I'm guessing it's not as simple as just sticking a few electrodes anywhere on the body, right?
You're absolutely right. The placement of these electrodes is incredibly precise, and it all comes down to something called ECG leads. Think of them as different camera angles, each capturing the heart's electrical activity from a unique perspective.
Okay, so like a film director uses multiple cameras. To get the full picture of a scene, we use multiple leads to get a complete view of the heart's electrical activity.
Exactly.
But
And just like a well-directed film, a 12-lead ECG gives us a comprehensive, multidimensional view of the heart's electrical symphony. It's pretty remarkable when you think about it.
so let's break down these different types of leads. Dr. Eldeeb's handout starts with the standard bipolar limb leads. I, of course, in 3. What makes them so standard?
Well, they were the first leads discovered, forming what's known as Einthoven's triangle, named after Willem Einthoven, a pioneer in electrocardiography. Picture a triangle with the heart at its center. Each side of this triangle represents one of these leads, measuring the electrical potential difference between two limbs.
Okay, so it's like we're measuring the electrical push and pull between different points on the body.
You got it. Lead eye measures the difference between the right arm and left arm, lead 2 between the right arm and left leg, and lead 3 between the left arm and left leg.
So each lead is giving us a slightly different snapshot of the heart's electrical activity.
Precisely. By combining these 3 viewpoints, we get a more complete understanding of the heart's rhythm and how electrical impulses are traveling through it. It's like triangulating a location. You need multiple reference points to get an accurate fix.
That makes sense. Now, besides those standard leads, Dr. Eldeeb also mentions unipolar limb leads. AVR, AVL, and AVF. What's the story with the...
These are sometimes called augmented leads, and they offer a slightly different perspective. Compared to the bipolar leads, think of them as zooming in on specific regions of the heart.
So instead of looking at the heart as a whole, we're focusing on particular sections.
Exactly. For example, AVR gives us a view of the heart from the right arm, AVL from the left arm, and AVF from the left foot. It's like having a camera crew focusing on specific sections of the orchestra, capturing the subtle nuances of their individual performances.
Okay, I'm starting to appreciate just how much thought goes into capturing all these different perspectives of the heart's electrical activity. But we're not done yet, are we? There are also those chest leads, V1 through V6.
The precordial leads. These are placed directly on the chest wall, offering the closest view of the heart's electrical activity as it travels through the ventricles.
Wow, so it's like having microphones right next to the heart, capturing every little electrical whisper.
That's a great way to put it. These chest leads are crucial for detecting subtle abnormalities in the heart's rhythm and function, especially in the ventricles.
Okay, so we've got all these different leads, each providing a unique angle on the heart's electrical activity. It's like having a team of photographers capturing every single detail of a breathtaking performance. But here's the question. How do we make sense of all this data?
That's where the skill and expertise of a cardiologist come in. They analyze the ECG, looking for patterns variations, and any anomalies that might point to underlying heart conditions.
So they're like detectives, carefully examining the clues to solve a medical mystery.
Exactly. They compare the ECG to a normal tracing, looking for subtle deviations in the waves, intervals, and segments. It's a complex process that requires years of training and experience.
It's pretty amazing how much information they can extract from those squiggly lines. But I have to ask, Why is all this so important for us non-medical folks? Why should we care about understanding ECGs?
That's a great question. And the answer is simple. Understanding the basics of ECGs empowers you to be a more informed advocate for your own health. It helps you understand what your doctor is looking at when they order an ECG and allows you to ask more insightful questions about your heart health.
So it's not just about blindly trusting the doctor, but about understanding the language they're using to assess our heart health.
Precisely. It's about being an active participant in your own healthcare journey.
I like that, being an active participant. So besides helping us communicate better with our doctors, are there any other benefits to understanding ECGs?
Absolutely. It can help you recognize potential warning signs and even empower you to take preventative measures to protect your heart health. For example, knowing that a prolonged QT interval can be linked to sudden cardiac arrest might motivate you to make lifestyle changes or discuss potential risk factors with your doctor.
Wow, I never thought about it that way. So just having a basic understanding of these concepts can actually have a real impact on our lives.
You bet. It's all about taking ownership of your health and being proactive. And, understanding ECGs can be incredibly fascinating in its own right.
I have to admit, I'm starting to get hooked on all this. It's like we're unlocking a secret code, revealing the hidden language of the heart.
And that's what's so exciting about this deep dive. We're not just learning about ECGs, we're gaining a deeper appreciation for the incredible complexity and resilience of the human heart.
Okay, I'm officially hooked. So where do we go from here? We've covered the waves, the intervals, the segments, the leads, the recording process. It's like we've gone from feeling lost in the woods to having a detailed map in our hands.
And it's a map that can lead to a healthier heart and a more empowered you.
I love that. So what's next on our ECG adventure?
Well, now that we have a solid foundation, let's talk about how all this knowledge translates into real-world applications.
Yes, let's do that. I'm eager to see how all these pieces fit together and what kind of insights we can gain from understanding ECGs. All right, so we've journeyed deep into the world of ECGs, explored the peaks and valleys of those squiggly lines, and even learned how they're captured with those electrode thingamajigs.
We've essentially become ECG detectives, deciphering the heart's secret messages.
Exactly. But now I'm really curious, how does all this translate into real-world scenarios? How do doctors actually use ECGs to diagnose and treat heart conditions?
Well, imagine you're a cardiologist, and a patient comes in complaining of chest pain. One of the first things you do is order an ECG.
Makes sense. It's like getting a first look inside to see what's going on.
Exactly. Now, let's say you notice an elevation in the ST segment. Remember we talked about how that can be a red flag for myocardial ischemia?
Yeah, it means a part of the heart muscle isn't getting enough blood, which could be a sign of heart attack?
Right. That ECG finding, combined with the patient's symptoms and medical history, would immediately raise your suspicion of a heart attack.
So the ECG isn't just a standalone test. It's a vital piece of the puzzle.
Absolutely. It provides crucial information that helps doctors make informed decisions about diagnosis and treatment.
That's pretty incredible. Are there any other examples of how ECGs are used in real-world situations?
Oh, tons. For example, let's say a patient has an irregular heartbeat. An ECG can help pinpoint the type of arrhythmia, whether it's atrial fibrillation, ventricular tachycardia, or something else entirely.
And knowing the specific type of arrhythmia is crucial for determining the right treatment, right?
Exactly. Each arrhythmia has its own unique characteristics and potential complications.
Wow, it's really amazing how much information those squiggly lines can reveal.
It is, isn't it? And we've only scratched the surface. ECGs are also used to monitor patients with pacemakers, detect electrolyte imbalances, assess the effects of medications on the heart, and so much more.
So learning about ECGs isn't just for medical professionals. It's something that can benefit everyone, right?
Absolutely. Even having a basic understanding of the key components and what they represent can empower you to have more informed conversations with your healthcare providers.
And who knows, maybe it'll even inspire some future cardiologists out there. But speaking of inspiration, I have to say this deep dive has been incredibly eye-opening for me. I never realized how much I could learn from just one physiology handout.
It's a testament to the power of clear explanations and a genuine desire to understand the workings of our own bodies.
Well said, and I think that's a perfect note to end on.
Agreed. We've decoded the mysteries of the ECG, explored its real-world applications, and hopefully sparked a newfound curiosity about the incredible symphony happening within each of our hearts.
So to our listeners, keep exploring, keep learning, and keep listening to your heart.